Alicia. Today I'll be doing an IM injection. I have all of my supplies needed. I have my needle with medication pulled up, obviously just air for the purpose of this video, and my syringe, and then an alcohol wipe, and normally it wouldn't be open, but we're just reusing for the sake of the video, and a Band-Aid. Hi, I'm Nurse Izzy, and today I'll be giving you your flu shot. Can you give me your name and your date of birth?
Grace 8801.
Perfect, and I'm just gonna scan your wristband, just make sure you're not lying. Okay, now I'm gonna shut the door for privacy and wash my hands and put on gloves. I'm gonna ask Grace, do you have any allergies I should be aware of?
Not that I know of.
Perfect, well we're gonna give you your flu shot in your arm right here, which you already have your sleeve pulled up. Perfect. You might feel a slight pinch during injection, and then we're gonna give you a Band-Aid, popsicle, make sure you're doing good, and send you on your way. So with an IM injection, there's 3 sites that you can give this. The deltoid, which I'll be demonstrating today, and you would use a 21 to 25 gauge needle that is 1 to 1.5 inches long, and that's for anything less than 2 milliliters of fluid. And the landmarks for that would be the acronium process, and you would do 3 fingers below that, and then the deltoid insertion, you do 2 fingers above that, and that space in the middle would be your zone to give your injection. And then vastus lateralis, which is your thigh, and that would be a 21 to 25 gauge needle that is 5/8 to 1 inch in length, and that is for anything from 2 to 5 milliliters, and you would do a hand's length away from the groin and a hand's length above the knee, and you want to give that in the lateral aspect to avoid any of those really important nerves that are right down the middle. And then for the ventrogluteal, we have the greater trochanter is where you put the base of your hand, and then you'd have your thumb pointing towards the umbilicus, your pointer finger pointing towards the anterior iliac spine, and then your middle finger pointing towards the iliac crest, and that V formation would be your site of injection. And then we're going to use that site to avoid the dorsogluteal because that is where our sciatic nerve runs, and we risk a lot of damage when we run it that way. So I'm going to begin my shot. So I'm going to first find my landmarks. And then I'm going to use the alcohol wipe to wipe off the area and leave it as a landmark. I'm going to get my injection. I'm going to pull the skin, insert at a 90-degree angle, grab the base, aspirate, insert. And then I would normally put the safety on and throw it in the sharps container, but for the rest of this video I'm going to do the scoop method. And then after I leave the room, I would want to document this, and I'd want to document the medication dosage, location, time, route, any patient education I provided, and any patient response that was there. Thank you.